And edema will be there.
Ну, правильно вы говорите, all part of face, because of the general process. А it's a local process. And it's usually asymmetrical, да? Some part of the, там, if it's left or right side affecting, it will be rate of
Overall edema, it could be due to thyroid also.
Конечно, да,
Mostly for the
миксэдема
old
может
age
быть.
women's, this is
Вот
the
поэтому,
reason.
вот правильно, вы начали думать, видите? Differential
Diagnosis.
diagnosis. То есть вот first questions, if it's general,
Then-
all parts
or localized.
involved, да, or some local and affects severe, да, affects the eyelids and картинка. И даже inflammatory process of the eyelids. Но, конечно, sometimes it's easy because you reveals source of infection, да, some small focus of the hyperemia with the purulent
Infiltration.
Да, infiltration. Тогда легче, да, тогда we understand that is because of this furuncle. Тогда your actions, it's a drainage, да, of the furuncle. Can you, general practitioner, perform some surgical manipulation?
No, ma'am.
No, ma'am.
No, ma'am.
No.
Only surgeon.
Only surgeon.
Only surgeon can do surgery.
Даже фурункул, да, нельзя вскрывать? Фурункул, abscess.
If it's on like a
May,
surgery,
да?
we can.
May. Вот, значит, то же самое. Значит, you may can drainage the фурункул. Да. А там ничего такого. Обколол, да? Infiltration of lidocaines. Take the scalpel and
Cut it.
cut it, да, and wash. Даже put the some specific
Lotions and
да, some solutions, hypertonic solutions or some inquentum. Но помним, if it's face and especially if it's trigonum, да, trigonum of death,
morbidity.
да, pain, follow the patient, temperature, symptoms of the brain, infiltration, то есть meningeal symptoms, nausea, vomiting, headache, да, subconsciousness, там какое-то состояние, да, такое, заторможенности.
Triggers are there or not?
Как?
Triggers.
Seizures, да, судороги, да? Ну, не исключено, да, особенно у детей, может быть, да. Вот. Sometimes you meet this patient in coma and no anamnesis. Поэтому so remember that furuncle may be inside in a vestibule of the nose because vestibule of the nose it's a skin, да, it's a skin with hairs. And so usually, да, it's a more often place for furuncles because, да, some patient like pick the nose, да,
With like nails.
да. И, конечно же, it's a dirty and, да, infected, easy infected. Вот, поэтому такое место, да. No, you, like a doctor, of course, may drainage this furuncle, sterile instruments, да, in a sterile condition. И usually after that you prescribe antibiotics because we are scared spreading infection to the brain, да, to the orbit and then to the brain.
This one.
Значит, prescribe antibiotics, prescribe,
Anti-inflammatory.
да,
drugs.
aspirin,
Aspirin.
anti-inflammatory and anti-aggregants, thrombosis, anti-aggregants.
Anticoagulants.
Да, и уже if it's severe stage, тогда direct anticoagulants, фраксипарин, гепарин. Значит, it's external nose, да, external nose. Так, окей, internal nose, Ambati.
Vestibule of nose.
Да, вот it's also separate on vestibule of the nose,
Nasal valve area.
nasal cavity, and vestibule it's skin, yes,
This one.
nasal cavity,
Nasal cavity proper.
да, proper it's area with a specific epithelium, да, respiratory epithelium. What name on the epithelium?
Lateral middle.
Epithelium.
Columnar.
Stratified squamous keratinized epithelium of the vestibule.
Ma'am, it's columnar epithelium.
No, stratified squamous.
Stratified columnar epithelium.
Ciliated.
Ciliated, yes, ma'am. Ciliated columnar
Вот,
epithelium.
правильно.
Ciliated
Ciliated columnar
epithelium.
epithelium. Why it's important to know about this structure, about this epithelium?
Yes, ma'am, because we breathe through nose, and the dust particle which enters inside our nose is protected by the ciliary columnar epithelium. That's
What
why.
structure
Then
of
it
this
purifies.
epithelium?
Cilia.
Cilia.
It is ciliated, that's why.
Only.
It is, no, sebaceous glands are also there, mucus.
Какой же sebaceous? Нет.
No.
It's 3 types of cells.
Yes.
There are contains 3 types of cells. Histology. It's a really ciliated cells,
Yes, ma'am.
cells which has a как бы brush of the
Brush border epithelium.
pseudopodias, да, cilias. Near the 200, да, on a tip of the cells. And it's a goblet cells.
Goblet
Да? Goblet cells produces
Mucus.
да, special secret of the epithelium. И не sebaceous, а какие? Это не sebaceous. It's a the mucus for superficial layers of the epithelium. Yes? И получается, да, how works this epithelium? It has some term, some name for the working of this epithelium. Mucociliotransport. Да, mucociliotransport. It works together. Movements of ciliars, all cells together, combines each other and move superficial layers of the sticky mucus. This surface glue their foreign bodies, some dirty pieces, antigens, allergens, bacteria, viruses, and transport to the posterior part of the nasal cavity. Then we clean the throat and swallow, and it's inactivate of the juice of the stomach, because it's acid. Or cough outside. And for this working system, what